Open a non-medical home care agency in your home. Interested in opening a profitable non-medical home care agency? I am giving a live webinar online and I have created a course. If you would rather take the course, then the course is $199 on Udemy, and the link is up here for you to go and look at the do-it-yourself course. However, if you would like to be a part of the online webinar training, I will act as your coach to show you how to start a profitable non-medical home care agency. I've been in the medical field for over 40 years, and I had three agencies, one in Denver, one in Arizona, and one in Michigan. So I am very much experienced on this. I opened my agencies the first one, which was in Denver. Well, actually, it's Colorado. Um, it's Colorado. I'm sorry. Actually, it's Aurora, Colorado, which is like the suburbs of Denver. Now, when I opened my agency, a lot of people will tell you you need a lot of money to open up an agency, and that just not is not true. When I opened my agency, I only had $250 to open my agency, and I started it in my home. I ran an ad in a particular paper that I was the only agency running an ad in there, and I ran it in classify, and it was very profitable. The ad actually cost $12 a week to run at the time. Now the ad is $16 a week to run. But I noticed recently that still you do not have a lot of other agencies advertising there. And I just don't know why. So that's my little secret that I will reveal in the webinar. Now, so anyway, with the $250 that I started, that was mostly to buy clerical stuff that I needed, and then the $12 a week for the ad. Within 1 month, I had my first patient, and that patient was a live-in case. And after paying the caregiver and everything, I profited. My profit was around $1,800 a month. And then after I got that patient, it took me another month, and then I got my other patient, and then I was just on a roll. So I really know this business. I've listened to some of the other people who have put up about non-medical home care agencies. I don't know how long they've been in the business, but some of the information really isn't correct. Now, I notice when they say they're going to give you a paid, they're going to give you how do you get your clients? They're telling you about marketing solutions to get your clients. Now, I'm going to tell you, I think it's like 3 or 4, maybe 5 different ways that you could pay to get a patient like right now. As soon as you're open, you can you open your agent, you're ready to start. I'm going to give you like 4 or 5 different paid options where you could get your patients right away. Now, the pay that you're going to pay is anywhere for per patient is anywhere from $15. This is to get a referred patient to you, or $150. So, and anywhere in between that. So it depends on your budget. If you don't have a lot of money to pay for a patient referral, then you could pay $15. Now, for the $15 one, you have to actually put up $75 in your account, and then each time they refer you a patient, they'll pull $15 out of the $75. And then when you're ready to reload that, you can reload that at any time. Every time you reload the $75, you'll just continue to get patients pulled out of the $15 out of the $75. But if you have more money to invest and to get in a client, then you can invest as much as $150 per patient for a referral. Anywhere in between that, because some places might charge $50, $25, like that. Okay, another thing is like AARP. I know everybody's familiar with AARP. I'm going to show you how to get on their website, how your agency could get on their website and you don't have to pay a dime. So I really know a lot of the little tricks and trade about this business. I've been in there a long time. I've been in the healthcare field for like over 40 years. I started out as the secretary to the director of nursing. That's how I started out. So I know a lot of things what go on into the hospital, how you get to the case managers and all of that. As I progressed through the medical field, I went on to be a CNA, which is a certified nurse assistant. And then after that, I went on to be a RN, which is a registered nurse. And then I went on to own my own company, as I just told you. And then I went back to school to get my doctoral degree in organizational leadership in the healthcare field. So I've been in the healthcare a long time, okay? So I'm going to tell you, how do you, and obviously you do want to connect to doctors and things like that. But a lot of times when people are trying to start out in the business, they may not have a lot of money. So you need to, and then sometimes when you go to their doctor's office, it might take a little time unless you're going to like your doctor, like if your doctor who you have a personal relationship with, and he might have senior patients, then you could talk to the receptionist and get patients like that. But for the most part, you have to, go out and market to new doctors, and they're just a little bit reluctant in the beginning if you have not. Um, if you don't have a relationship with them. So I'm going to show you what to do, how to get in with those doctors' offices, because a lot of people don't know this, but all of the doctors, what they do is that they have lunch. You actually have to provide lunch for the office or for the people who you're going to be presenting in front of. You actually would set up a time with them to provide lunch, and they already do this with other agencies. But sometimes when you go and you ask, like you give them your business card, sometimes they don't even tell you that they do that. They'll just take your flyer and take your brochure and say, oh, okay, we'll put it up. But that's not, I mean, they're going to put it up, but you're never going to get a call. What you have to do is set up those luncheons that they definitely give, and then you'll just have to provide a catered lunch for however many members they're going to be there. They'll let you know how many is going to be there, and then you would give a presentation of your agency. Now, maybe they don't tell a lot of people that is because they might be bombarded with a lot of people coming in and leaving their business cards, so they're just not gonna, tell you. And another thing too, some doctors' offices, they need the skilled home care nursing. So this is for non-medical. So therefore, you'd have to hook up with the doctors that are providing, they have patients with non-medical care patients. We're going to go over all of that in the webinar. Again, I really know this field. I ran an agency, so everything that, and plus I worked in different fields in this agency, in this healthcare. I worked in a hospital, I worked in a nursing home, I worked in assisted living. I mean, hey, I was the director of patient services in some assisted living facilities. So I really know this field and know how it's operated from inside and out, meaning the management part all the way to like the direct patient care part. And I'm going to show you what you need to do to make your agency profitable, okay? So now I reduced the price on this webinar because of everything that's going on with this COVID-19. People might want to get in this field, but maybe, financially they're not able or something right now. So I reduced the cost to $5.95 for this particular course. Now, what you can do is contact the office if you need a payment plan, because we definitely would be willing to do a payment plan with you. Um, so that you can get started. Now, some agencies doing this COVID-19, I've talked to some agency owners and they haven't skipped a beat. I mean, they are still really busy all the time. But then there are some that things are not as busy because the patients are afraid for caregivers to come in their home. And then there's some that weren't busy, and then now they're starting to be busy again. So I would say that this is the time for you to get the education on how to do it, and then go out there and begin to doing it. Because let me tell you, if there's somebody who is, even if it's slow, is somebody who needs caregiving, and you could get the this is probably a good time where you can get the paid referrals. Now it depends on the area that you're at. Denver, they say, have a large population of seniors, and I got really good referrals there. But in Arizona, I mean, I really got a lot of referrals. In Arizona, I must have was getting like 10 referrals a week. No, I'm sorry, a day in Arizona with my agency. 10 referrals a day, every day. So Arizona was definitely more busy. In Denver, I would say, and this was during the busy time. And in Denver, I would say I got like referrals, maybe um 10 a week. Maybe I got 10 a week. But let me take something back. In Arizona, when I got that many referrals, it actually was not the busy time. Arizona, the seniors leave, a lot of the seniors leave there in the summer and come back in the winter. So people who live there was telling me, oh, in the spring and the summer, it's really slow and you'll do really good in the winter. Well, that wasn't true for me because when I signed up, it was like the end of spring and the beginning of summer, and that's when I was getting 10 referrals a day from them. And I actually remember thinking, my goodness, if this is this busy now, what in the world is it like, you know what I mean, in the wintertime when all the seniors are there? So I did really good in Arizona. And again, that was a slow a period, supposed to be, but it was really busy for me. Let me see. Okay, so that's some of the things. I'm going to go over some more things that we're going to talk about in the webinar, but I just want to, because people really want to know usually upfront, how am I going to get my patients? So I'm going to show you this, and then hopefully while we're setting things up, because you're going to get coaching from me for 6 months after you take the webinar. So hopefully, we can go through this, and then you can get a patient, you'll have your first patient quickly. Um, so you won't have to wait long. You can get your first patient while you're still learning. Okay, let's go to the next slide. Some of the things that you will learn in this course is how to set up your business structure, recruiting caregivers training, how to create a policy and procedure manual, the new hire packet, marketing. Okay, so you will also learn the future of healthcare, patients and caregivers rates, because each state is different for how much you charge. So I'll show you how to find out what they charge in your area and help you set that up. Patient in-home consultation, 2 quiz, and then the paid patient referrals that I was telling you about. I'll show you how to set up your patient billing and much, much more. When you take the live webinar course, and also if you take the do-it-yourself course, you'll get all the forms, your policy and procedure manual, your assistance with getting your EIN and your DUNS number, and you'll have coaching support for 6 months. Okay, so you will also receive guidance in recruiting quality caregivers, your pricing strategies, you'll get assistance with that. State licensing, if it's required in your state, will help you with that. Assistance with home care memberships, associations and with the accreditation associations. Now, when you first start out, accreditations are very expensive. So you probably don't want to get that in the beginning when you're first starting. You want to wait till you become more profitable, and then you can go into applying for accreditation. But we'll still show you how to do that at the webinar. And that information is also on your do it yourself, the courses too, on Udemy. Is also on there. It's just the name of the different accreditations where you would apply. Also, I own a travel agent, so you'll also have an 800 number for taking the webinar where you can call in to get all your travel need and to get discount travel. You'll also get guidance in the in-home consultation, the patient's in-home consultations. Now, we'll show you how to do it, and then you will, practice with us, how to do that. Like, we'll do role playing for that so that you can really be confident in that. You don't want to go in somebody's home and you don't have much confidence and you're tripping over your words and everything. Like, you don't know what you're doing and all of that. So we're going to really make sure that you're confident. So you'll have a lot of time to practice that. Okay. So that's the end of this slide. Now, the healthcare business is a very profitable business. It's extremely profitable, and we'll go over that the first day of the webinar to show you how you can. It's easy to bring in $100,000 a year through home care. This is a very lucrative business. So we'll go over all that on the first day. So if you need to contact the office, here is the email: info@globalelite.media. If you need to contact the office because you need a payment plan or more questions or anything like that, just contact the office. If you're ready to sign up, you can go to the website, which is www.globalelite.academy, and you could just go on and sign up for or purchase the course, and then someone will contact you with the date that the course is going to be given and any additional information that you might need. The phone number to the office is located on the website. So if you go on the website, then you can see the phone number there. If you rather call, then send in an email. We prefer you send in an email because we get a lot of inquiries, and we try to get back with you as soon as possible, rather than the phone. Sometimes we're really busy and we can't take the call, and then we'll have to you have to leave a message and we have to end up calling you back. But sometimes you could call and we could be, we're not so busy. So you could try either way, but we do prefer the email. But sometimes I understand, like, if you have a question, you don't want to wait for the email. You want the answer right away. So just feel free to call or email. All right then. Well, good luck, and look to see you at the webinar.